Welcome to Public Health Matters, where we talk about matters of public health. I'm Bobbie Bagley, Chief Public Health Official and Director for the City of Nashua's Division of Public Health and Community Services. And I'm here today with Paige Beauchemin, who is a, how do I say it, Paige? Let me let you introduce yourself.
Sure.
And we're going to talk about all things that are related to maternal mental health, or as you have now coined it as perinatal mental health. So Paige, go ahead and introduce yourself. And I know that I probably messed up your name after you told me how to say it correctly.
No, I was going to say you did great.
Did I?
You did
Okay,
it correct.
all right.
Yes, so thank you. So I'm Paige Beauchemin. I am a registered nurse, and I'm working towards my perinatal mental health certification. I've been a nurse for about 15 years, and prior to that, I did a lot of work with women's health in other avenues through massage and psychology. So that's what I did. I've done a lot of prevention and education. I've worked high risk, low risk, inpatient, outpatient, and all of my work has revolved around women's and maternal child health with a foundation of health equity and mental health. So I've done a lot of that crossover between what are the factors that lead to positive outcomes for women and pregnant people across the lifespan.
And
to narrow
awesome.
it down.
Yeah, no, but that's, you know what, that's
Yeah.
really awesome, because there is a lot more attention that is now being paid to women's health. And
Finally.
it's due, right, and it's due, right? Because we make up about almost half of the population, 49% of the population. We make up more than half of the workforce. And women who are pregnant are part of that workforce as well. So let's talk about some of the things that are related to mental health, that are related to perinatal mental health.
Yep.
And in particular, Paige, because this month in particular, we have been focused on looking at suicide prevention. September is National Suicide Prevention Month. September 10th is actually World Suicide Prevention Day. And so I see some of the work that you do really, really important with creating awareness around the fact that mental health is so important for everyone. But we know that there are some hormonal factors that impact women during pregnancy.
Absolutely.
And so those things can impact that individual's mental health, what then impacts the family as well. So how do we address some of those factors and the work that you do
Thank you.
with the Owl Hive?
Yes,
we gotta talk about the
I
Owl
will.
Hive.
I won't forget.
Yes, and why we are the Owl Hive. But let's talk about some of those things that are related to women's health, in particular around mental health.
Yeah, so I will thank you, first of all. Thanks for having me. This is my life's passion, my favorite thing to talk about. And I've joked, but it's true. For years I've said, if I do this one thing in my career, I will feel successful. And that is to help everybody know that we need to stop saying postpartum depression and use the more inclusive terms. So we've gone through some different terms in the last decade, but where the professionals in this space are now is that we're calling it perinatal mental health, and perinatal means around. So we do that because there's two pieces, right? We say postpartum and depression. Well, we know it's not just postpartum. At least 50% of women and birthing people who are going to have a mental health condition will develop it by the end of the first trimester or in the second trimester. In addition to that, it's way more than just depression. And for me, that's the scariest thing, is that people think it's just depression. So when we think it's this one thing, we miss all the other symptoms of different conditions, because people might think, oh, I'm not sad. So what we now look at is a spectrum of mood and anxiety disorders. So under depression falls baby blues, which is those first 2 weeks.
And what does that look like? So when we say baby blues, what does that actually look like for a person that has given birth? What does baby blues actually look like?
At least 80% of people who have given birth will have the baby blues within the first 2 weeks. And that is really, really highly attributed to that extreme hormonal shift after they have the baby.
The loss of all of that.
And it's,
estrogen.
Any woman that's had PMS kind of understands when you're hormonal and you're doing something that you don't know why you're saying or doing it, and you're just like, my emotions are out of control. That's kind of how it feels. It's very similar to depression, and there's like a Venn diagram. You might feel overwhelmed, maybe feeling like, why did I do this? I'm not going to be a good mother. I don't know what I'm doing.
Crying, or
sadness,
why am I
irritability.
sad? I just had a baby. I should be happy.
And I love to, so this is my impression, right? Because this happened to me. A lot of 80% get the baby blues. So my joke is, my second child, my daughter, about a week postpartum, I'm holding her. She's a week, and I'm watching a commercial of this dad driving his daughter to college. And I look at her and I go, you're growing up so fast, and you're gonna go to college, and I'm gonna miss you. And I'm crying. And then I'm laughing at myself for crying. Then I'm crying because that's
what it looks like.
Right?
That's
that
what it
is
looks
the baby
like.
blues.
Okay.
But there's two really key factors that separate it. And this is so important, and one of the things that'll help us identify. I've talked to many women who say, they're 3 or 4 months postpartum, and they say, I just have a little touch of the baby blues. And my heart goes out because I need to, they need to know that actually the baby blues ends at 2 weeks. And if you're still feeling this way past 2 weeks, there's something else going on that would really benefit you to look into getting some support for. The other very important factor is that baby blues does not include suicidal thoughts. And so if within those 2 weeks, a person is having suicidal thoughts, that is an emergency, and it needs to be addressed immediately.
So, Paige.
Yes.
How do we get partners to pay attention to those changes, to those emotional changes that can result from different types of thoughts that then can lead to different feelings that then lead to certain actions?
Sure. So there's, in addition to the baby blues, there's that depression with its own list of symptoms. And then what's interesting is people think that the next place on the spectrum is psychosis. And it's actually not. It's not on the spectrum of depression. It's not a part of that disease progression. The psychosis where you would harm your baby, right? That's not a part of depression. And in fact,
so I'm glad that you made that clarification.
Yes.
Because as I was speaking with you earlier, I said, from what we see in the media, you'll see postpartum depression, and then you'll see, or you'll hear about a mom that may have done some things and harmed her kids, and it's connected to the depression.
Well, and that's why I want people to stop saying depression. So what we look at now very closely is actually bipolar disorder, and that's on the spectrum of mood disorders. And with bipolar disorder, we now believe that postpartum or pregnancy psychosis, because it happens in pregnancy, especially if people go off their meds, which we can talk about later. But with bipolar disorder, we now believe psychosis is the manic phase of bipolar disorder. And because we know that mania can lead to hallucinations, delusions, and things like that. And that's what we think it is.
That's what we're seeing.
And that's right.
Is that related to the hormones, or we're past that point?
I think it usually happens, if it's going to happen postpartum, it most frequently happens in the first 2 weeks. So it is hormonally triggered. Additionally, for people who are diagnosed with bipolar disorder, oftentimes the first time they experience that mania in their life is during pregnancy or postpartum. So it's something, you have your risk goes up if you have bipolar disorder prior. And if your mother or sisters or close female family have bipolar disorder or had it around their perinatal period. So personally, I say to every single person that has bipolar disorder or that strong risk, to establish therapeutic care during pregnancy, so that, because if there's a problem later, they need to get in right away. And the wait is long. The other thing is, it can actually be very, it can be hidden well. I actually worked in an outpatient psychiatric clinic, one of the first in Pennsylvania, maybe the second one in Pennsylvania, and I was on the team that helped build that. And we actually had a woman who was in her manic phase in the 2 weeks postpartum. We had been working with her because she had that experience with her first child.
Okay.
And so we saw her throughout her pregnancy. We knew her baseline. So when she came back postpartum, our psychiatrist picked up on the differences. And we didn't have emergency services, so we sent her to the ER. They let her go home. They said she didn't seem like she was experiencing any psychotic symptoms.
Wow.
And so it's, you really need to be able to pay attention.
What was the outcome of that? Was she in a space, Paige, where she was able to recognize what was happening and reach out for help? Was there someone at home?
Right, that was it. We had been working with her family the entire time, and they called us. They said they just released her from the ER. We need to do something now, and so we helped support that family. But that's why I think it's so important, because those symptoms are totally different. And the symptoms of bipolar disorder coming out as mania postpartum would be a lot of the things we see otherwise, which is tons of energy, starting lots of projects, risky behaviors like sexual activity, spending money. That irritability is a big one, and severe mood swings. You'll also notice people get paranoid a little bit. And so I've seen a mom, she was a colleague, she knew about this stuff. And in her postpartum period, she had a great relationship with her mother-in-law. She was convinced her mother-in-law was scheming against her to steal her son and take him away from her. Another person was convinced her husband was cheating on her, and it was this family. We knew the husband, we knew the family, we knew everything beforehand. Suddenly he was cheating on her, and there was this conspiracy. So you pick up on that. The other really big key, like if you see this, get somebody to the hospital, is postpartum. If you're sleeping 2-3 hours a night and I ask you, are you tired? You might think that's a silly question. Of course I'm tired. People will say, no, I've got tons of energy. I'm only getting 2 to 3 hours a night and I feel great. That person needs some support, right? So what I do is there are many conditions, and the other ones on the anxiety spectrum would be anxiety, OCD, which if we have time we should certainly talk about that.
And OCD is
I'm so sorry. Yes,
just explaining it all out for our viewers and our listeners who may not have a background in mental health.
I appreciate that. I'm always trying to look out for that, and it's super important that as clinicians we're really aware of that. So OCD is obsessive compulsive disorder, and then of course we have the spectrum of trauma, so birth trauma and PTSD, and like 10% of postpartum women get PTSD from their birth experience.
Oh, so post-traumatic stress. Oh,
yes,
really?
I did it again, right?
But that's
post-traumatic stress disorder.
From birth.
From their birth experience, either a severe pregnancy experience, oftentimes it's birth trauma, and oftentimes it's a NICU experience. So being in the NICU in the postpartum period will really increase your chances of a perinatal mental health condition. So the barriers to this, I mean, there's so many barriers, but one of the main ones is stigma in education, right? People don't know they don't even know that it's not depression, right?
And that's why, Paige, we have you here, because as I'm listening to you explain all of these things, and so we, at the health department, we used to do home visiting. So we used to do, this was a while ago, back in the late 90s when in fact, they were doing it even before then, but when I started at the health department, it was in the late 90s. And every mom that gave birth that had Medicaid insurance, within 72 hours, we were deployed to do a home visit.
Isn't it amazing?
Yeah, and so just all of this information that you're sharing right now is information that we probably needed to have back then.
Oh, 100%.
But it's absolutely very timely that we have it now. So whenever we can get new information, it's good to have. And so this is good. There are some home visiting programs that are still in place here, in New Hampshire. we at the health department unfortunately don't do them anymore. But
so
we do see
unfortunate.
the babies when they come in for their vaccines right away. And so
Yes.
our staff, can be paying attention to some of these moms
Absolutely.
and maybe asking just a few questions
Yeah.
during that time that they're together during the immunizations. And so can those doctors and nurses and practitioners
And
when they're doing
midwives,
those,
yeah.
and when they're doing those well baby checks.
And I forgot to tell you at the beginning, we know this is important, but we talk a lot about maternal health. And we finally have been hearing more about maternal outcomes. And we know that the U.S. is the most dangerous place to have a baby in the industrialized world. And worse for people of color.
As wealthy as this country is, as resource rich as we are, that we would have birth rates and maternal mortality data that shows us we're down in the 30s. We're really low.
Yes.
Which is really sad. And this is why, I say the importance of women's health, paying attention to women's health and maternal health, because this has been going on for years.
Pretty much as soon as we moved away from midwives, this is midwifery.
Yeah, that's what the history shows.
That's what the history shows.
What the history is showing. Yes.
The interesting thing about that is that the leading, so I might have left this out, but perinatal conditions are technically defined as pregnancy until 1 year postpartum. So that's another thing, is people can be 6 months, 8 months out, and it still would be considered a perinatal condition. But with all of that taken into consideration, perinatal mental health is the #1 leading cause of pregnancy-related deaths in this country. When you take into account, very timely here, suicide and overdose. Yeah. And so it boggles my mind, right? At people who are pregnant, we look for hypertension, which is high blood pressure, right? We look at that preeclampsia, people have heard, gestational diabetes. We're looking at all these things. Those occur in somewhere between 5 and 10% of pregnancies, whereas perinatal mental health conditions, they show up in up to 20% of people, and yet this information's so new.
So Paige, look at the difference though, right? For some of the things that you mentioned, there are outward signs of those things.
Yes.
Whereas with the mental health conditions, you may not actually see it.
That's right.
That's why you have to ask. You have to ask the question, right? And so let's talk a little bit more about asking the question. Who needs to ask the questions? And again, because people spend so much time with their family, what do family members need to know?
Thank you for asking that. What I would say there, that is super, super important. We need that. And for that to be effective, we also need to address the stigma. Because what happens is women are asked, and sometimes they do get screened. Sometimes that's spotty as well. But even when women get screened or they're asked, because of the stigma, they don't answer honestly, they hide it, they don't admit it to themselves. So first, as a culture, we need to be talking about this. The program that I helped develop, women would come to their first pregnancy visit, and they receive screeners for depression, anxiety, and bipolar disorder. First visit, before anything else, while they're in the office waiting.
And is this Owl Hive?
No, this was in Pennsylvania.
Okay.
But what that
we're going to get to Owl Hive,
we'll get to Owl Hive.
Okay.
But what that does is that instills right away, mental health is a part of my pregnancy care, right? So we need to do that. We need to have grandparents, community members, anybody who's ever been around a pregnant person, which is everybody,
paying attention,
should know this, right? So we need to do that. Then we need to be educating the partners, the parents, the grandparents, the cousins, friends, family, right? Everybody needs to know that. But once that happens, so we're kind of going through the barriers, right? Stigma, education. And then the next thing is identification, right? And managing through all of those pieces, will we get them to be identified? Can we get them to that place where they're ready and willing? But once that happens, they have to navigate the healthcare system.
Right.
What insurance? What kind of provider? How is that going to, how long is it going to take for them to get there? All of those things. And on top of that, this really should be addressed by reproductive health specialists. So psychiatrists, nurse practitioners, medicine prescribers, and therapists, social workers, et cetera. They need to be trained in this specifically because there's nuance to it. And we don't have enough people who are certified. There's a certification now people can get. It's the one that I'm working on as an affiliated professional, but there's an organization, Postpartum Support International, that will certify people in perinatal mental health, and they have a psychiatrist track, a therapist track, and an affiliated professional. So that's how people like home visitors, lactation consultants, doulas, they are like the prime people that can catch this.
Okay.
So, but how
and
do
this
we?
is offered in New Hampshire.
Well, no. I'm just saying in general.
Well,
right?
You said that so what is the program that you're in right now that you're getting your certification
Oh,
in?
that's the Postpartum Support International.
Okay.
They do their certification, and it's national. It's actually a global organization.
So if I wanted to do it,
yeah,
they as a nurse, as a public health professional, is this something that I go online to do?
They actually have one in Manchester at the end of the month if you want to go. But they also have online classes. So you take essentially 3 or 4 days worth of education, and then you have to go to one of the testing sites where people go for licensing, and you take a big exam.
And then get the certification.
And then you get the certification. So,
that's awesome.
But let's get back to this. So this is why I started Owl Hive, and Owl Hive is a business.
Now we're on Owl
we'll
Hive,
do it.
and we got to talk about how you came up with that name.
Yes, and so I've done education across the lifespan. I do sexuality education. I said to myself, perinatal mental health is the most important thing that I need to get out there right now. So I started Owl Hive because eventually I see what I do as kind of working around the birds and the bees, but that's like played out. So Owl Hive stands for the birds, owl, and the hive is bees. But the bird is also—
How clever.
Thank you. The owl is education. And the hive is about community, because that's really kind of where I want to focus, is building up that infrastructure. And so with Owl Hive, and you can check it out if you want, it's called owlhivehealth.com. So pretty easy to remember, spelled like it sounds. So owlhivehealth.com. And what I'm doing is I want to address the different areas. And so I'm offering parent classes, so that childbirth ed kind of vein, where you would take newborn care, a 2-hour class for parents, grandparents, any support people that want to know that, so that they know what to look for.
Yes,
and
that's so important.
Then I'm offering community classes for folks like maybe the people at your office, right? Maybe a church group where the elders want to know what to look for, that kind of a thing. That helps us address the stigma and the identification. And finally, what we were kind of alluding to a little while ago is that I now provide continuing education credits for professionals that need that for their license. So I do one for behavioral health specialists.
Nice.
And then I have one for maternal health specialists, because the therapeutic folks need to know what happens in pregnancy medicine.
Right.
And the OB folks need to know how the therapy will be handled. So
that is, wow, so I like the Owl Hive.
And I do consulting. Wait, I do consulting for infrastructure.
So we can keep you, Paige, pretty busy.
Well, I love to be busy.
Because we have a community that's growing. We have a community that across the lifespan, again, when we're focused on paying attention to what's going on around us, when we're focused on trying to enhance prevention, right?
Yes.
Prevention of these crises that can occur, prevention of suicide.
Prevention of infanticide, which is when you're hurting your child, right?
That psychosis, right? And so we want to be able to, and that's what this program is about.
Yeah.
So these things matter to the public. These things are at a population level that are occurring, which makes it a public health issue.
Oh, I mean, it's a public health crisis in my mind. I mean, obviously, I feel that way. I'm a little biased, but I think it to be true. So, you know, you've asked me the same question, and I keep going off. What do people look for? What should you say? Well, I teach a 2-hour class on that, so I can't go through everything. But what I would say is getting the education beforehand, thinking about perinatal mental health during pregnancy and learning about it so that you and your support people know what to look for. But really, when addressing it, I always tell people, talk beforehand to your loved ones and your partner.
Right.
Talk about how you want them to address you, because everybody's different. Some people need someone to say, you got a condition, I'm calling the doctor. Some people need you to say, skirt around it. Hey, I notice you're not really yourself. You seem really stressed, is a nice word for anxiety. Do you want to talk about it? Like, what would you think about talking to so-and-so? Or maybe you refer them to their mom or their friend that had it.
Right,
so you got to like build that up
You're
the chain.
engaging. You're at least letting the person see, know, and understand, I see you.
And the biggest thing, you know, with mental health, there's always stigma. When you are a new mom, to admit maybe that, you know, to admit something that might give the impression that you're not happy being a mom or that you're a bad mom. So I would say the number one thing, whatever the communication is having, however you communicate it, the sense that you are not alone.
Yeah.
Many, many people experience this. It is not your fault. You know, trying to decrease the shame that somebody might feel, however it works for them. And what I always tell people is, you know, whenever I end a class or anything, I say that exact thing. You are not alone. This is not your fault. You didn't do anything wrong.
Right.
The good news is you can get better.
Right.
And there is help out there.
Yeah. And that goes to, you know, this is also Recovery Month, right? And so we can recover from things. We can recover from trauma. There's work, there's support that may be needed, but we can recover from it.
Yeah.
So Paige, we have a little bit of time left. What is the number one takeaway that you want our viewers to get from you today? And again, I want you to talk again about the opportunity for people to engage in the Owl Hive.
Yes,
so what
thank
is that,
you.
What is that number one
Yeah.
takeaway that you want our viewers to get from this conversation
sure.
today?
So I would like to see people using those variety of sources wherever you fall. You know, I think we agree on this. Education is key.
Yeah.
So finding that education, if you're a parent, find a class where you can do that. If you're a community member, whatever organization you're a part of, let me know, help me come out and talk to those folks. If you are a professional, now I can't certify people, I can give you the intro and I can help you learn where to go from there if you think, hey, I want to do this. And finally, I offer consulting. So if you own a therapy office, if you manage an OB office and want to learn how can I build the infrastructure to address this more effectively, I can help with that. And so I'd say education, education, education.
That is awesome. Paige, thank you so much for being with us today on Public Health Matters. I'm Bobbie Bagley, and I'm reminding you to have a great day today and a better day tomorrow. And I will see you next time on Public Health Matters.
Thanks, Bobbie.
Thank you.